Every single morning, millions of Americans over 60 are doing something that quietly puts their heart in serious danger. And the most terrifying part is that most of them have no idea. These are not unusual habits. These are things you probably do every single morning before you even have your first cup of coffee. A heart attack does not always come out of nowhere. Sometimes it starts in the first 30 minutes after you wake up. And today I am going to tell you exactly what is triggering it. Stay until the end because the last habit on this list is the one that sends the most seniors to the emergency room, and almost nobody is talking about it. Welcome back to Senior Health Secrets Over 60. I am Dr. Jessica Reed, and this channel is dedicated entirely to helping you live a longer, healthier, and stronger life after 60. If you are new here, please subscribe right now and hit the bell so you never miss a video. Today we are talking about something that could genuinely save your life. We are going to go through the morning habits that are silently damaging your heart, and I am going to tell you exactly what to do instead. Let me ask you something. Have you ever woken up in the morning feeling a little off? Maybe your chest felt tight. Maybe you felt dizzy when you stood up. Maybe your heart was beating a little faster than usual. A lot of my patients tell me they brush those feelings off. They think it is just part of getting older. But here is what I need you to understand. Those feelings are your heart trying to talk to you. According to the American Heart Association, heart attacks are significantly more likely to happen in the early morning hours, between 6 a.m. and noon. That is not a coincidence. That is biology. And when you combine that natural vulnerability with certain morning habits, you are putting your heart under enormous pressure. According to the CDC, heart disease is still the #1 killer of Americans, claiming over 695,000 lives every single year. That is one person every 34 seconds. And a disproportionate number of those people are seniors over 60. You deserve to know the truth about what is happening in your body every morning. I have spent 15 years working with patients over 60. I have helped thousands of seniors manage their heart health, reduce their risk, and feel better than they thought possible at this stage of life. But here is what most doctors will never tell you. The danger is not just in your diet or your exercise routine. Sometimes the greatest danger is in the most ordinary moments of your day. And your morning routine may be one of the biggest risks you are taking without even knowing it. So let me start with the first habit, and this one is going to surprise you. Number 1 is jumping out of bed too fast. I know that sounds almost too simple, but this is one of the most dangerous things a person over 60 can do first thing in the morning. Here is what happens inside your body when you sleep. Your blood pressure drops, your heart rate slows down, your entire cardiovascular system goes into a kind of rest mode. That is a good thing. Your heart needs that recovery time. But when you sit up or stand up too quickly, your blood pressure has not had time to adjust. It drops sharply. Your heart suddenly has to work much harder to push blood up to your brain and through your body. For a young person with a healthy cardiovascular system, this is uncomfortable but manageable. But for someone over 60, especially if you have any history of high blood pressure, this sudden change can trigger what doctors call orthostatic hypotension. That is a sudden drop in blood pressure when you stand. It can cause dizziness, fainting, and in serious cases, it can put dangerous strain on your heart. I had a patient named Harold. He was 67 years old and in pretty good shape overall. Every morning, he would hear his alarm and immediately swing his legs over the side of the bed and stand straight up. One morning, he got dizzy, grabbed the nightstand, and felt a crushing tightness in his chest. He ended up in my office, and we discovered his heart was under significant stress every single morning because of this one habit. What I told Harold was simple. Before you get up, lie there for 60 seconds. Breathe slowly. Then sit up and stay sitting on the edge of the bed for another 30 seconds. Let your blood pressure catch up with your body. That small change made a real difference for him. Give your heart a gentle start to the day. Do not shock it awake. But that is just the beginning. Because number 2 is something almost every senior does, and it can be far more dangerous than standing up too fast. Number 2 is skipping water in the morning. When you wake up, your body is dehydrated. You have just gone 7 or 8 hours without drinking anything. Your blood is thicker. It is more viscous. And thick blood is harder for your heart to pump. According to research supported by the National Institutes of Health, dehydration is a significant factor in cardiovascular strain, especially in older adults. As we age, our sense of thirst becomes less reliable. You may not feel thirsty even when your body genuinely needs water. And if you skip hydration in the morning and go straight to coffee, you are actually making things worse. Caffeine is a mild diuretic. It pulls water out of your system. So if your first drink of the day is coffee without any water before it, you are starting your heart off working too hard against thick, sluggish blood. One of my patients, a lovely woman named Gloria, was 71 years old. She told me she never drank water in the morning because she just was not thirsty. She would have 2 cups of coffee and then eat breakfast. She kept experiencing what she described as a fluttery feeling in her chest in the mornings. Once we identified the dehydration connection and she started drinking a full glass of water before anything else, those feelings went away within 2 weeks. The fix here is genuinely simple. Keep a glass of water on your nightstand. Before you do anything else in the morning, before coffee, before checking your phone, drink that full glass of water. Your heart will thank you immediately. Now you might think, okay, I will just have my coffee after my water and everything will be fine. But number 3 might make you rethink your morning coffee routine entirely. Number 3 is drinking coffee on an empty stomach. I want to be careful here because I am not telling you to give up coffee. For many seniors, coffee has real health benefits. But drinking it first thing in the morning on a completely empty stomach is a habit that puts genuine strain on your heart. Here is why. Caffeine stimulates your adrenal glands to release adrenaline. Adrenaline raises your heart rate and temporarily raises your blood pressure. When your stomach is empty, caffeine is absorbed into your bloodstream much faster, so the effect is more intense and it hits your system more quickly. According to the American Heart Association, sudden spikes in blood pressure are a known trigger for cardiovascular events, especially in people who already have high blood pressure or arterial stiffness, which is very common after 60. I had a patient named Raymond who was 64. He was retired and loved his morning routine. He would wake up, skip breakfast, and drink 2 large cups of coffee within the first hour. He kept getting palpitations and occasional chest pressure in the mornings. We tracked his blood pressure and discovered it was spiking significantly right after his morning coffee. The simple solution was to eat something small first. Even half a piece of whole grain toast or a few bites of oatmeal before coffee dramatically reduces how quickly caffeine hits your bloodstream. You do not have to give up your coffee. Just do not let it be the very first thing in your body every morning. I know some of you are nodding along right now, but I need you to keep watching because number 4 is the one that genuinely shocks most of my patients when I tell them. Number 4 is ignoring morning chest discomfort. This might sound obvious. If your chest hurts, see a doctor. But what I am talking about is subtler than that. I am talking about the small, easy-to-dismiss sensations that people brush off every single morning. A mild tightness, a slight pressure, a vague heaviness, a little shortness of breath walking to the bathroom. My patients tell me all the time that they felt something was off for days or even weeks before a serious cardiac event, and they ignored it because it did not feel like what they thought a heart attack should feel like. According to the NIH, many heart attacks in older adults, and particularly in women, present with atypical symptoms. Not the dramatic crushing chest pain you see in movies. Instead, fatigue, mild discomfort, nausea, jaw pain, or back pain. These symptoms are often worse in the morning because of the cardiovascular changes your body goes through overnight. I had a patient named Elaine. She was 68 years old. Every morning for 2 weeks, she felt a mild tightness in her chest that went away after about 20 minutes. She thought it was anxiety or maybe acid reflux. She finally mentioned it to me almost as an afterthought during a routine visit. I sent her for testing immediately. She had significant blockage in one of her coronary arteries. We caught it in time. Please, if something feels off in the mornings, even if it is mild, even if it goes away, tell your doctor. Do not wait. Do not dismiss it. Your instincts about your body matter enormously. And speaking of things people dismiss, number 5 is one of the most common morning habits I see in my practice, and most people have no idea how hard it is on the heart. Number 5 is straining during a morning bowel movement. This is a topic doctors do not always bring up, but it absolutely needs to be said. When you strain hard during a bowel movement, you are performing what is called the Valsalva maneuver. You hold your breath, tighten your abdominal muscles, and bear down. This dramatically increases the pressure inside your chest and abdomen. It temporarily reduces blood flow back to the heart. And then when that pressure releases, there is a sudden rush of blood back into the heart. For a younger, healthy cardiovascular system, this is manageable. For someone over 60, especially with any heart history, high blood pressure, or arterial stiffness, this repeated pressure cycle can be genuinely dangerous. According to research cited by the American Heart Association, straining during bowel movements has been associated with triggering cardiac events, particularly in older adults. The solution is not complicated, but it does take consistency. Make sure you are eating enough fiber every day. Stay hydrated throughout the day. Consider talking to your doctor about a stool softener if constipation is a regular issue. And never rush or force a bowel movement. Your heart was not designed for that kind of repeated pressure first thing in the morning. Before I go further, I want to take a quick moment to ask you a favor. If this video is helping you understand your heart health better, please take 2 seconds right now and hit that like button. It truly helps me reach more seniors who need this information. And if you have a parent, a spouse, or a friend over 60, please share this video with them right now. It could genuinely make a difference in their life. Okay, let us keep going because we still have some critically important habits to cover. Number 6 is taking medications without checking the timing. Many seniors over 60 take multiple medications every morning. Blood pressure medications, heart medications, diuretics, blood thinners. And most people just take everything at once when they wake up without thinking about it. But the timing of certain medications matters enormously for your heart. For example, some blood pressure medications work best when taken at a specific time in relation to meals or other medications. Some heart medications should not be taken on a completely empty stomach. And some combinations can cause dangerous interactions if taken too close together. According to the FDA and supported by NIH research, medication timing errors are a significant cause of preventable cardiovascular complications in older adults. I had a patient named Thomas who was 72. He was taking 4 different heart-related medications every morning all at once, with just a sip of water right after waking up. He kept feeling dizzy and lightheaded in the mornings. After reviewing his regimen carefully, we realized 2 of his medications were causing a compounding blood pressure drop effect when taken together on an empty stomach. Spreading them out and taking them with food made an enormous difference for him. Please sit down with your doctor or pharmacist and review exactly when and how each of your medications should be taken. This is not something to figure out on your own. Now I have saved one of the most important points for last. And number 7 is the habit that I see contributing to the most cardiac stress in my patients over 60. Number 7 is intense physical activity immediately after waking. I am all for exercise. Exercise is one of the best things you can do for your heart. But launching into intense physical activity the moment you wake up, before your body has properly adjusted to being awake, is seriously hard on your cardiovascular system. In the morning, your blood is thicker, as we discussed. Your blood pressure is adjusting. Your heart rate is climbing back up from its overnight low. Your blood vessels are still in a more constricted state, and your body has not yet released the hormones it needs for physical exertion. Pushing your heart hard in this state puts enormous demand on it all at once. According to the American Heart Association, the early morning hours carry the highest risk for cardiac events, and vigorous, unwarmed-up exercise during this window significantly increases that risk in adults over 60. A patient of mine named Barbara, she was 65 and very motivated about her health. She would set her alarm for 5:30 a.m. and go straight to fast walking on her treadmill at high speed within minutes of waking. She started experiencing chest tightness and shortness of breath during these sessions. What she needed was a simple warm-up, 10 minutes of slow, gentle movement, some light stretching, a brief walk before increasing intensity. Giving her body time to transition from sleep into exercise mode eliminated those symptoms. Exercise is good for your heart. Shocking your heart with intense exercise before it is ready is not. Always warm up. Always give your body time to wake up fully before you push it. Now let me tell you exactly what you should do starting today to protect your heart every single morning. Here is your morning heart protection plan. When your alarm goes off, do not jump up. Lie still for 60 seconds and breathe slowly. Then sit up and sit on the edge of the bed for another 30 seconds before you stand. The moment you are up, drink a full glass of water before anything else. Keep it on your nightstand so it is ready for you. Before your coffee, eat something small. Even a few bites of oatmeal or a piece of whole grain toast is enough to protect your stomach and slow down how fast caffeine affects your heart. Take your medications exactly as your doctor or pharmacist recommends, with the right timing and the right amount of water or food. If you are not sure about the timing, call and ask. It is worth that 5-minute conversation. Pay attention to how your body feels in the morning. If something feels off, even slightly, do not brush it off. Write it down and mention it to your doctor at your next visit. And finally, if you exercise in the morning, spend the first 10 minutes moving slowly and gently. Let your body wake up fully before you ask your heart to work hard. These are not complicated changes. They are small shifts in habits you already have, but the difference they can make for your heart over time is enormous. Let us do a quick review of everything we covered today. We talked about jumping out of bed too fast and why it shocks your cardiovascular system. We talked about skipping morning water and how dehydration makes your blood harder to pump. We talked about drinking coffee on an empty stomach and the blood pressure spike it causes. We talked about ignoring mild morning chest discomfort and why those small symptoms matter. We talked about straining during bowel movements and the heart pressure it creates. We talked about medication timing errors and how they can compound cardiovascular risk. And we talked about exercising too intensely right after waking without giving your body time to transition. Every single one of these habits is fixable, and every single change you make is a gift you are giving your heart. You have worked hard to get to this stage of life. You deserve to enjoy it in good health. Your heart is incredibly resilient when you give it the right support. And the morning is where that support begins. I want to hear from you now. Which of these habits did you not know about before watching this video? Leave a comment below and let me know. And if you have a morning habit that you are not sure about, ask me in the comments. I read them and I care about your questions. If this video helped you today, please hit that like button and subscribe so you never miss another episode. And share this with someone you love who is over 60. You might be sharing something that genuinely protects their heart. Next week, I am going to be talking about something that affects nearly every senior, and almost nobody connects it to heart health. You will not want to miss it. I am Dr. Jessica Reed, and I will see you in the next video. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor before making any changes to your health routine.